أنت غني عن التعريف يعني.
Thank you, Dr.
Welcome
Rehan.
on the stage.
Thank you for this introduction, and I would like to thank the organizer for inviting me for this talk, and it's really beautiful Congress and all the success for them. So I think the most important thing that we can take from my presentation or my colleagues, Dr. Dani's previous presentation, is anatomy. If you know the anatomy, then you are away from all the problems. Okay. So, before I start my presentation, look at this picture and tell me what emotion do you think this patient is exhibiting? Who can say that he is happy? Can you raise your hand? Happy. Who said it's sad? Again? Okay, let's look at this picture. What do you think now? Is this person is happy or sad? Sad. And now? It's the same person, and he is sad. So really, the upper face is tell us everything about the emotion. It is the region that we use to understand the emotion of the others, and it is the aesthetic center of the face, and where we look at the face to estimate the age. It's the first facial region to show signs of aging and can tell us everything about how we look, not like the magic mirror. Kotofana found that the forehead is one of the most frequent location for neuromodulator injection, and this is due to easily visible, located close to the eye, and show early signs of aging. And more than 7.5 million injections have been done in 2019, which is about 800% increase if we compare it from year 2000. And with increased use of the botulinum toxin in upper face, the complication rate can also increase. And some literature show that up to 43% complication can be seen in such area of treatment. Most of these complications, however, is simple and self-limited, but serious complication can also occur as asymmetry and ptosis like brow ptosis or idle ptosis. And CT have found that most of these complications happen due to inexperience and lack of knowledge in anatomy. So it's important to understand that if you want to have a good treatment with lack of complication, you need to have 3 pillars of knowledge, which is anatomy, physiology, and technique. Now we know that the position of forehead and eyebrow is affected by multiple muscles: frontalis, corrugator supercilii, depressor supercilii, procerus, and orbicularis oculi. When it comes to frontalis, it's a pair of muscles that originate from gallia aponeurotica and at the coronal suture line and insert to the deep dermis of the eyebrow, where it mixes with the muscle of orbicularis, corrugator, and procerus. There are 4 different patterns of frontalis muscle. Type 1, when both muscles are attached to the midline and cover the whole width of the forehead. Type 2, when it is a V-shaped with center of the forehead is covered by gallia aponeurotica. Type 3, when you have only central part of the muscle and the laterally it is void of muscle. Or type 4, when there is a lateral for muscle belly and the center part there is no muscle. And this led to formation of different pattern of forehead wrinkles. So we have straight wrinkles, we have a wavy wrinkles, we have central wrinkles, and we have lateral wrinkles. And it's important to understand this different type of wrinkles in order to put the right treatment plan. Now, when the line indicates the direction of the frontalis muscle, so wavy line usually show that the muscles are more on the frontal side than on the center. And Swift have found that the length of these lines can indicate how width or how wide the muscle is. So some of the muscles are so wide that it even cross the temporal crest and go to the temple area. So you have to understand this when you are planning the treatment, and your injection should also go more toward the lateral side. Now, Kotofana have found that there is something called a C-line or a convergent line, that the movement of the frontalis muscle is not unidirectional, but it's bidirectional. So the lower part of the muscle pull the eyebrow upward, but the upper part of the muscle pull the hairline downward. And there is a convergent line, which is about 60% of the width of the forehead. And he advocated that whenever we do the treatment for the frontalis muscle, the treatment should be deep to the suprapreosseal plane when we inject above the convergent lines, and it should be only subdermally injected when we are injecting below the convergent lines. Now, how much we should inject? There is a variation in the amount of the dose, but usually it's 2 to 5 units if you are injecting in the upper forehead, and 0.5 to maximum 2 units when we are injecting in the lower forehead. The injection point should be distributed symmetrically in a zigzag pattern, as we see here. So 2 rows in upper forehead, and if you have to inject below the convergent line, you should inject it in 1 row. Now, it depends also on the shape of the muscle and the lines. So if you have a straight horizontal lines, the pattern should be more flatter. However, if you have a wavy line, the pattern should be more steep. So the central injection, as we see in this picture, so the pointer probably is not working. So the central injection should be more toward the lower part. Now, what adverse effect that we can see when we are injecting the frontalis muscle? Eyebrow ptosis can happen, and this is because injecting of the botulinum toxin in an area which is below this line. So any injection should be above 2 centimeters from the supraorbital rim. And whenever we treat frontalis, we have to treat also corrugator and glabellar region, because if this is not over weakened, then the corrugator and procerus will pull the medial part of the eyebrow downward and lead to these deformities. Mephisto appearance can happen also if we are injecting the frontalis muscle with escaping the lateral part of the muscle, which lead to the what's called spook appearance. So how to treat this problem? By injecting the lateral part of the frontalis muscle with 1 to 2 units or 1 to 3 units, about 2 centimeters above the maximum projection of the eyebrow. Now, when it comes to glabellar muscle, it is more complex than the forehead. There are 3 muscles working in this area, also with contribution of the frontalis muscle and medial orbicularis oculi. And this led to a different pattern of wrinkles, which is a vertical, horizontal, and oblique wrinkles. So it's important to understand the anatomy and which area that the muscle are intermingled together, and in which area are the muscles separated. Now, when it comes to corrugator, it originates from the medial part of the superciliary arch. It inserts to the skin over the middle eyebrow, where it penetrates the frontalis and sometimes the orbicularis oculi, and it has 2 heads. As we see in the picture, we have a transverse head and the oblique head. We should know that the muscle is more thicker toward the medial part than the lateral part, and when you are putting the dose, you have to put more on the medial part than the lateral part. D'Souza have found that there are 3 different types of this muscle insertion. We have a fan-shaped insertion, we have a rectangular insertion, and a narrow ribbon insertion, and this led to formation of 3 different patterns of wrinkles in the glabellar region. So we have a hockey stick wrinkle, a multiple vertical wrinkles, and a single straight line wrinkles. And the pattern is also different from one side to the other, so it is not symmetrical all the time. This creates a 6 different patterns of wrinkles. So whenever you treat, you have to treat based on the shape of the wrinkles and not just standard treatment. So this is also a person who have a hockey stick wrinkle on one side, but multiple vertical wrinkles on the other side. Now, when it comes to depressor supercilii, many articles say that this is an extension of the corrugator supercilii or orbicularis oculi, but Daniel found this as a distinct entity where it originates from the fascia covering the lower part of the nasal bone, and it inserts into the skin below the eyebrow. And it's responsible for depression of the medial brow and formation of the glabellar line. When it comes to procerus, it is a pyramid-shaped muscle that originates from the nasal bone and inserts into the skin between the eyebrow, and it's responsible for the transverse horizontal line between the eyebrow. Now, when we treat the glabellar region, we usually put 5 injection points, 4 units in each point, so a total dose of 20. And in order to have a proper treatment without causing any complication, you should not inject lateral to the mid-pupillary line. So the injection should be lateral to this line, and when we inject, we should inject superficially in the lateral part of the corrugator supercilii, so it should be only subdermal injection. And whenever we treat the corrugator, we should treat the frontalis muscle, otherwise we will have something called a splay effect. So splay effect, it's because the frontalis and the horizontal part of the orbicularis oculi pulling the eyebrow laterally. So if you treat the corrugator and procerus, and leaving this frontalis and orbicularis not over affected or weakened, then they will pull the eyebrow laterally. So we should avoid this by injecting corrugator and frontalis simultaneously at the same time. Now, what complication we can have when we are injecting or treating the corrugator and glabellar region? Blepharoptosis is one of the complications that happen, and this is because of diffuse of the toxin into the levator palpebrae superioris. So injection, when it's done, it should be done in the corrugator, and the needle should be directed upward, and the place thumb over the superior orbital rim to prevent dissemination of the product downward. And do not inject, as we mentioned earlier, in the lateral to the mid-pupillary line. And if the complication happen, you can use something called alpha-sympathomimetic eye drop, which overactivate the ulnar muscle, which will reduce the ptosis of the eyelid and help in elevation of the upper eyelid. Now, when it comes to orbicularis oculi, it's a large flat muscle that have 3 divisions: the orbital, the palpebral, and the lacrimal part. It originates from the medial palpebral ligament and run around the eye or the globe, where it inserts into its original point. And it's responsible when it contracts to the formation of crow's feet wrinkle. So it is more pronounced than other wrinkles in the face, and it's the reason due to lack of the sebaceous gland in this part of the skin, where it causes more dryness of the skin and more formation of the wrinkle, and also because of the zygomaticus major muscle contribute also to elevation of the cheek and formation of these wrinkles. Now, when we inject this area, we have to do 3 injections. The central injection should be about 1.5 to 2 centimeters away from the lateral orbital rim, and the upper and lower injection should be 30-degree angulated to the tail of the eyebrow and to the lower part of the cheek. Now, it's important when we do the injection that the placement of the upper injection, because this will lead to elevation of the eyebrow and depressing of the brow depressors, the orbicularis oculi muscle. Also, one tips when we inject the orbicularis oculi is injecting in the lower eyelid, and usually we do that 1 to 3 millimeters below the lower eyelid margin at the mid-pupillary line, and we put 1 to 2 units of botulinum toxin, and this will help to widen the palpebral fissure and appearance of the bigger eye. Now, I was mentioning about the doses, which is important to know the standard, but the dose has to be individualized also. Bravo have found that the glabellar complex and the forehead doses usually decrease with age, and we have to understand this. However, the preorbital wrinkles usually become more exsanguinated and apparent with the age, and you have to increase the dose in the crow's feet area. There was a study by scientists in 2020 where they compared 2 groups of patients, one who had 5-point injection, the standard, and one individualized based on the anatomical variation that we see. And they found that the patient who had individualized treatment significantly performed better with much higher response at 20 days after the injection. So it's important that you understand the anatomy, understand patient requirement, and the dynamic wrinkles of the face in order to plan the treatment and not just copy and paste as we do previously. Thank you very much.
Thank you, Doctor.